Let me ask you something that might surprise you. Have you ever looked in the mirror and thought, wait, was it always this small? If that moment ever made your heart skip, you're not alone. And no, it's not your imagination. Google didn't make it up, and neither did your buddy at the gym. There's a real medical reason your most prized possession might look a little different as you age. And today, I'm going to tell you exactly why it happens. And most importantly, how to stop it. Or even reverse it. Because, yes, it is absolutely possible. I'm Dr. Rabeeca Ross, and this is your crash course in the Penile Shrinkage Protection Plan. A practical, science-based way to keep your body, your blood flow, and your confidence strong for life. But first, let's talk about what's really happening down there. The real reason for shrinkage, and why it's not your fault. Now, you can't fix a problem unless you understand it. Shrinkage isn't just about size, it's about circulation. And the medical term for it is atrophy, which simply means that tissue is losing strength and structure because it's not getting enough blood, oxygen, and nutrients. Think about it like this. Every cell in your body is like a little worker that depends on good oxygen delivery. Your heart gets it, your brain gets it, and yes, your penis needs it too. But as we get older, the blood vessels that feed those tissues begin to stiffen. Their inner lining, called the endothelium, becomes inflamed, damaged, or narrowed. Doctors call this process atherosclerosis. Now, you might have heard your doctor mention cholesterol buildup. That's part of it. But the bigger problem is that the blood vessels lose their ability to open up the way they used to. They stop producing enough nitric oxide, which is the molecule that helps blood vessels relax and expand. And when that happens, less blood gets where it needs to go, including to the erectile tissue. So what's the result? That tissue, which depends on fresh blood to stay healthy, begins to shrink. It's the same process that can make your brain shrink with age, or your kidneys shrink if they don't get enough circulation. It's not vanity, it's biology. The hidden everyday triggers. Now, here's where it gets interesting, because it's not just aging. There are everyday habits that quietly speed this process along. Let's start with something every man remembers. Those spontaneous nighttime erections in your 20s. They were basically your body's way of saying, hey, I've got this handled. 5 to 8 times a night, your body was doing tiny workouts, push-ups for your erectile tissue. But as you age, those nighttime workouts start to fade. Fewer dick-ups, as one of my patients jokingly called them. And without those natural exercises, blood flow slows down. Now, if you're married or in a long-term relationship, there's another twist. You might have thought marriage meant more intimacy, but studies show the opposite. Most couples actually have less sex after marriage, and even less once kids come along. Less sex, less circulation, more shrinkage. Every erection, whether during sleep or intimacy, is literally an exercise that nourishes and maintains tissue health. When that frequency drops, it's like skipping leg day for years. You lose tone. The testosterone connection. Now let's talk about your body's natural performance booster, testosterone. As men age, testosterone levels start to decline. But here's the catch. It's not just about having less testosterone. It's also about your body becoming less responsive to it. That means even if your blood test looks okay, your tissues might not be using that hormone efficiently anymore. And low testosterone doesn't just affect your energy or mood. It directly affects blood flow and tissue integrity. Over time, that can accelerate shrinkage and reduce firmness. So you're dealing with two fronts: blood vessels that aren't delivering enough oxygen, and hormone signals that aren't being heard clearly anymore. Together, that creates the perfect storm for atrophy, the belly connection, and why optics matter too. Now, I want you to do a little experiment. Go ahead, stand sideways in the mirror. See that belly? If it's starting to push out a bit more than it used to, that's not just an aesthetic issue. A growing belly actually contributes to shrinkage in two major ways. First, optics. When your belly grows outward, it visually makes everything below it look smaller. But second, And far more important is what's happening inside. That belly fat is a red flag for insulin resistance, meaning your body's struggling to manage sugar properly. And insulin resistance doesn't just affect your metabolism, it wreaks havoc on your blood vessels and hormones. It's like pouring sugar syrup through delicate pipes. They get damaged, sticky, and less efficient. That inflammation further reduces blood flow and disrupts testosterone function. So when your gut grows, your blood flow slows, and your erections suffer. It's all connected. Why this matters and why there's hope. Now, if you're sitting there thinking, well, that's just what happens when you get older, let me stop you right there. Shrinkage is common, yes, but it is not inevitable. There are men in their 70s and 80s with fantastic circulation, excellent erectile health, and strong confidence. Not because they got lucky, but because they learned how to protect their blood flow, nourish their cells, and stay active where it counts. And the good news? You can start doing the same thing right now, even if you've already noticed some changes. Because in the second half of this video, I'm going to show you exactly how to protect your blood vessels from further damage, restore healthy blood flow to your erectile tissue, and yes, actually reverse the signs of shrinkage. And the best part, you can do it at home. No injections, no surgeries, no expensive procedures. Just science, movement, nutrition, and consistency. But before we move on to the actual game plan, I want to leave you with one thought. Your body is constantly renewing itself. Your skin, your muscles, even your blood vessels. If you give it the right environment, it will repair. Your only job is to understand how to help it do that. So let's dive into how to prevent shrinkage before it ever starts, and how to bring real vitality back if it already has. All right, let's talk solutions. Because knowing why shrinkage happens is one thing, but learning how to stop it and even reverse it is where the real transformation begins. I call this the Penile Shrinkage Protection Plan, and it works because it focuses on one simple truth. If you take care of your blood vessels, they'll take care of everything else. Step 1. Protect your blood vessels, like gold. The first step is what I call an endothelial makeover. Your endothelial cells are the delicate lining inside every blood vessel. When they're healthy, they produce nitric oxide, that magical molecule that helps blood flow freely and keeps tissues oxygenated. But when those cells are damaged, blood flow drops, and shrinkage follows. So how do you rebuild them? Start by boosting your magnesium intake. Magnesium reduces inflammation, prevents tiny clots, and keeps those vessel walls smooth. Low magnesium makes the blood thicker, stickier, like trying to pump syrup instead of water. You can get magnesium from leafy greens, nuts, seeds, avocados, and dark chocolate. And yes, a small piece of dark chocolate at night can actually be medicine. Next, focus on vitamin C. This antioxidant helps your body make more nitric oxide and protects that precious endothelial lining from stress and oxidation. Think citrus, berries, bell peppers, or a good supplement if you're not big on fruit. And don't forget flavonoids, those colorful compounds found in blueberries, pomegranates, apples, and even green tea. They improve nitric oxide production and help your vessels stay flexible, young, and responsive. If you don't like juggling bottles of supplements, I've got a simple shortcut. I call it my E-Function Smoothie, a blend designed to feed your blood vessels everything they crave. You can find the recipe linked below, along with a free guide on how to eat for your erection, so you'll never have to guess again. Step 2, move your body like it matters, because it does. The next step is simple but powerful. Move. Blood flow follows motion. If you sit all day, your circulation slows, your blood thickens, and your nitric oxide production drops. You don't need to become a marathoner. Start small, gentle walks after meals, a bit of stretching in the morning, a few minutes of deep breathing at night. Movement wakes up your arteries. And yes, the belly we talked about earlier, when you start moving more, it starts to shrink, which not only improves your optics, but directly improves your hormones. Belly fat feeds insulin resistance. Insulin resistance lowers testosterone. Lower testosterone weakens erections. See how it all connects? So, think of every walk, every push-up, every time you choose to park a little farther away as an investment in your circulation. Step 3. Stay sexually active, even if you're celibate. Now, this one surprises people. Even if you're not currently sexually active, you must keep the blood flowing down there. Why? Because erections are not just for pleasure, they're for maintenance. They're like physical therapy for your erectile tissue. You can be celibate and still healthy, as long as you're getting regular erections. Those nocturnal push-ups we talked about earlier, they matter. And if they're not happening naturally as often, you can help your body along. Stimulation, massage, or even a quick mental fantasy that gets blood flowing counts. You don't have to finish. This is about circulation, not climax. It's like flexing a muscle so it doesn't forget how to work. Step 4. Sleep like your health depends on it, because it does. You might not realize how important good sleep is for size and function. Your body produces most of its testosterone while you sleep. That's also when those spontaneous erections happen, your body's natural exercise time. But if you're waking up multiple times a night to use the bathroom, scrolling on your phone at 1 a.m., or sleeping only a few hours, your body never gets the chance to do its job. Aim for at least 6 or 8 hours of uninterrupted sleep most nights. And if you struggle, start simple. Dim the lights an hour before bed, cut caffeine after 2 p.m., and make your bedroom a calm, cool space. Better sleep means better hormones, better erections, better life. Step 5. The pump protocol. The right way. All right, let's address one of the most misunderstood tools out there, the penis pump. You've probably heard mixed reviews. Doesn't work. Temporary. Dangerous. Here's the truth. When done properly, it's one of the most effective ways to rehabilitate erectile tissue. In fact, it's been used in hospitals as part of post-prostate rehab, helping men regain size and function after surgery. Here's how to do it safely. Get cleared by your doctor first, especially if you have any blood disorders or take blood thinners. Use a quality medical-grade pump. Cheap ones can cause injury. Start slow, 3 to 5 minutes under vacuum pressure, then release. Repeat that cycle twice. Do it 4 or 5 times a week. This mimics the pressure and expansion that natural erections create, gently stretching the tissues, encouraging new blood flow, and restoring elasticity. Will it magically add inches overnight? No. But over time, as blood flow improves, most men notice a visible and measurable difference in fullness, strength, and yes, confidence. Step 6. Massage and mobilize. After pumping, use a natural lubricant and massage from the base toward the tip in slow, firm motions. This helps move blood through the tissue and keeps the vessels supple. This is sometimes called gelking. But the key is gentle consistency, not force. You're guiding circulation, not wringing out a towel. Then, take an extra minute to massage your testicles while in the shower. Those little factories produce up to 95% of your testosterone. Gently tug downward and massage in circles to boost local blood flow and hormone output. It's a small daily ritual that pays big hormonal dividends. Step 7. Get stiff. Naturally, the pump gives you a mechanical erection, but your goal is to encourage real ones. That's where mental and physical stimulation come in. Whether through intimacy, fantasy, or morning energy, let your body practice creating natural erections. Each one breaks down tiny plaques inside the blood vessels, stretches the tissue, and signals your brain that everything is functioning well. It's not about performance pressure. It's about reconnection. Because when you reconnect with your body, your confidence returns right alongside it. Step 8. Fuel your future. This last step ties it all together. Live like your blood vessels are your most precious asset, because they are. Eat whole, colorful foods, stay hydrated, move daily, keep stress low. Avoid the trap of ultra-processed foods that spike insulin and inflame your vessels. They rob you of nitric oxide, testosterone, and vitality. Instead, choose foods that feed your circulation: spinach, beets, citrus, dark berries, olive oil, salmon. They're your natural Viagra. And remember, the less sugar and processed oil you eat, the better your blood flow will be. Hope, healing, and new beginnings. I know this can feel personal, maybe even a little uncomfortable, but I want you to hear me clearly. There is absolutely hope. Your body is not frozen in time. It is constantly rebuilding. When you start nourishing your vessels, balancing your hormones, and moving again, your body responds, and you don't have to spend thousands, or go under the knife, or feel ashamed. Just start with one small thing. Maybe magnesium tonight, or a walk tomorrow, or turning off your phone an hour early. Every little choice adds up, because you're not just protecting your size, you're protecting your circulation, your confidence, and your quality of life. Your next step. If this message resonated with you, don't stop here. Take this as your sign to take action. Download my free guide below. Eat for your erection. It's full of the exact foods and habits I recommend to every patient who wants to keep their energy, blood flow, and vitality alive at any age. And make sure you subscribe and turn on notifications. Because in my next video, I'm going to show you the specific daily routine I teach my patients to keep their nitric oxide levels high and their hormones balanced naturally. You deserve to feel vibrant, confident, and strong at 30, 50, or 80. And the truth is, with the right care, you absolutely can. I'm Dr. Rabeeca Ross, and I'll see you in the next one. Take care of yourself and of the life flowing through you.